Hi, I'm Dr. Wayne Kohan. I'm a chiropractor and a board-certified clinical nutritionist. I've been in practice for 30 years. And today I want to demonstrate to you what I do in my office. It's called nutrition response testing. And what's interesting about it, I do not diagnose or treat anything. What I'm looking for is an organ that's under stress and why it's under stress. Because many times, if we have a health problem and we go and see our primary care provider, they do blood work, and they tell us that they found a problem, but they can't tell us why. What I do here in my office is I find that why. So I want to demonstrate it to you right now. So I use a process called muscle testing, and all I do is I ask the patient, match my pressure, and then I start at the frontal brain. I do the top of the head, the back of the head. I do the cerebellum. I do the pituitary gland. I do the hypothalamus gland. I do the frontal sinus. I do the eyes. I do the maxillary sinus. I do the top of the teeth. I do the bottom of the teeth. I do the throat. I do the thyroid gland. I do the lung. I do the bronchioles. Lung again. I do the heart. I do the liver. I do the gallbladder. I do the stomach, spleen, pancreas, small intestines, large intestines. So here is ascending colon, transverse colon, a descending colon, and sigmoid colon. On a female, then I do ovaries, I do bladder and uterus. On a male, I do bladder and prostate. Then I do kidneys and adrenal glands, and I do kidneys and adrenal glands. Now, when I take my hand and I go over an organ and I use the thyroid, I put a little pressure on there. If there is a problem there, now what's going to happen is your nervous system is going to perceive that as a stressor, and it's going to downregulate, meaning it's going to make a strong arm go weak. And once that occurs, I know that there's a stressor there. I want to know what the stressor is. So I use these test kits. On the top, I have immune challenges. I have bacterial, I have viral, I have fungus and parasite. On the bottom, I have food sensitivities. So I have 30 vials here of all different foods. I have 30 vials of environmental, I'll call them toxins or chemicals, and 30 vials of heavy metals. And all I do is these vials are all a different substance. Everything in nature has a frequency to it. So each one of these vials is a different frequency. All I do is I lay the whole kit on your body. Your nervous system is going to receive all these frequencies. If it matches to one of these frequencies, it's going to shut this reflex off. So that means that if the arm goes weak, then the arm's going to go strong. Now once that occurs, I know which category it is. Then I would have the patient, I would have him take their finger and touch each vial so I could identify exactly which vial. And then once I know that information, I know what I would use for that. I use standard process. That is my standard product line. Those are whole food nutrients. I would grab these vials. I lay them on the body. It's the same concept. I don't have to take the pills out because, again, there's a frequency here. I just lay it on the body. If the body matches to it, it's going to shut off this reflex and the arm's going to stay nice and strong. Like I said, I've been doing this work for 30 years. If you have a health problem, you can't figure out what it is. I want to know what is causing your body not to function properly. And I use a testing technique called nutrition response testing. I can be reached at 602-374-2762 if you have any questions. I'd be more than glad to have you call, and I can answer any questions that you may have. And again, I do not treat or diagnose anything. I'm looking for an organ under stress and what is the stressor. Thank you.